Good morning. Good morning and welcome. And thank you so much for joining us. I see that we have a few parents that have already logged on. Would like to welcome our parents and introduce Mr. Harold Kennedy, who is our school business administrator, Dr. Jennifer Cedeno, our assistant superintendent for teaching and learning, Mr. Rafael Cortez, who is our assistant superintendent of schools, and I'm Olga Hugelmeyer, the superintendent of schools. Would like to welcome our parents. And also I see we have one of our supervisors, Mr. Joseph Persitula, who's our supervisor of physical education and health. Thank you so much for joining us today. Would like to share, parents, that we will be utilizing the chat room. If you look at your screen at the very bottom, there's a feature called chat. As I present information, please, if you have any questions, please type your questions in the chat room. And at the end of our session, we will be addressing questions. And thank you so much. I'm going to begin by sharing my screen. Later today, this presentation will be available on our webpage, as well as the recording of today's presentation. So parents, I'm sure this is familiar to you. We had, when we reopened our schools in September of this school year, we had shared a presentation on the reopening of schools, our 21-22 guidebook. I have updated the guidebook. As you could see, it's been revised effective today. And this is based on new information provided by the CDC. So would like to share our message as we prepare for the reopening of our schools in person on Tuesday, January 18th. Please be advised that there have been several guideline updates as it pertains to the exposure to COVID-19, as it pertains to quarantining and wearing masks. In our commitment to provide the safest learning environment possible for all of our students and team members, we wanted to share these guidelines with you today to provide a better understanding of the protocols that our district will be observing in accordance with the New Jersey Department of Education. In recent days and weeks, the New Jersey Department of Education has updated its guidelines in accordance with the CDC recommendations and will continue to do so as information is gathered, analyzed, and assessed. So it's very important to continue to provide our community with information, with the data that we have gathered, and important to remain as flexible as these guidelines are dictated by the conditions that have changed repeatedly and rapidly. The 2021-2022 guidebook has been updated based on these new guidelines. It's our goal to continue to provide our students the in-person education that they deserve, that best addresses their academic, their social and emotional needs and development. Then our best chances of succeeding is working together. So let me begin by reminding our school community of our pledge to returning to schools responsibly. We are following all the CDC guidelines. We recently met with all of our principals and we reviewed these guidelines to ensure that everyone has a thorough understanding of how it is that we are operating based on the updates from the CDC. So our principals are prepared and able to answer any of your questions, as well as our school nurses. Would like to remind our community with regard to our guiding principles. So our commitment from the very beginning is to ensure that we exceed the minimum expectations because we place health and safety as our priority, to provide high quality instruction to all of our students, and as evidenced today, to deliver accurate and timely communication to our team members and our families as needed. Today's recording is in English, and I will also be providing a presentation that will be in Spanish. Also want to remind our families that on our district webpage, we have all of the information available in the multiple languages. So beginning with Governor Murphy, who on January 11th, during his budget address, talked about the importance of keeping our schools open. He considered it critically important for our kids to learn better when they're in their classrooms, and that our educators are more effective when they are before a classroom. And certainly we know that virtual learning is no replacement for in-person instruction. However, we are guided by the data. the data within our community, as well as the guidelines from the CDC. So the governor reiterated just how important it was for us to be able to return now that our cases have dropped significantly in the city of Elizabeth. A message from Mayor Bulwich with regard to a reminder: COVID-19 testing is available Monday to Friday from 9 to 5, as well as Saturdays from 10 to 3 at the Stephen Sampson Center. And we have this information that will be available online today. So you're certainly able to use the QR code or to register online at the link provided here. Also, as a reminder to our parents that there are various COVID-19 testing centers all throughout the city of Elizabeth. So we have included that in our guidebook so that you have that as a ready reference. These are all the locations with the phone numbers and with the dates, times in which you are able to access a COVID-19 test. So the focus of our message today is based on the New Jersey Department of Health guidance that was issued on January 12th. And we wanted to make sure that we provided this to our families as quickly as possible. Once the guidelines were issued on the 12th, as you know, we sent a letter out to our community on the 13th with the step-by-step updates, which we'll be reviewing today. We also met with all of our administrators, and now here we are on Saturday, January 15th, meeting with our parents. So these guidelines are important because the New Jersey Department of Health took the CDC guidelines and created a document that would help us to understand how these guidelines apply to our schools. And now I'm going to spend a little bit of time. This chart is really very important, and I think it helps us to understand the changes that the CDC has recommended. So let's begin with the symptoms, correct? Let's start at the very top and begin with our symptoms of COVID so that our families are aware. So symptoms can range from mild to severe, and they may appear 2 to 14 days after exposure. So it can include congestion, a runny nose, cough, muscle or body aches, a new loss of taste or smell. It could be a sore throat, could be fever, can also be nausea or vomiting or diarrhea, could also be a headache, or shortness of breath or difficulty breathing, as well as having fatigue, just not having that energy, correct? So those are the symptoms. And then the question that the CDC begins with is, do you have symptoms that are consistent with COVID-19 or have you tested positive for COVID-19? So let's go through. Let's start with over on our far left, over in this section here, the first red box. No, I do not have symptoms, but yes, I tested positive. So what the CDC is recommending is that you isolate for at least 5 full days. Parents, this is very important because prior to these guidelines, we had to isolate for 10 full days, but now it's been reduced to 5 full days since that positive test was taken. You may leave isolation after at least 5 days, right? If you wear your mask around others for a full additional 5 days, right? So for 10 days, you want to make sure that even if you are at home, or if you're going to the supermarket, if you're going to the pharmacy, that you are wearing that mask for those 5 additional days if you have tested positive. And during this time, you should avoid situation where a mask cannot be worn, right? So that's what the CDC is recommending. You can now go from 10 days down to 5 days, but they want to make sure you are wearing that mask if you leave your home and go outside. And then as you can see here, it is very important that you reevaluate if your symptoms appear during this time. So now let's go to our next box. Yes, I have symptoms, and yes, I have tested positive. So it's recommended, right, if you have symptoms and you also have a positive COVID test, you have to isolate for 5 days from the time your symptoms start until you're fever-free for at least 24 hours without taking Tylenol or aspirin or anything else, and your other symptoms are improving. You may leave isolation after at least 5 days if you continue to wear your mask for a total of 10 days since your symptoms appeared. And during this time, you should avoid situations where a mask cannot be worn. Right. So as they give you examples, avoid going to the restaurant during this time, avoid going into a high risk population, correct? A crowded area and travel. So parents, we talked about, no, I do not have symptoms, but I tested positive. And yes, I have symptoms and I tested positive. And what you can see here that they have in common is isolate for 5 days. Now, let's go to our next one. Yes, I have symptoms, but no, I have not tested, or I'm waiting for my test results. It's very important. The CDC reminds us, and that's why the rapid tests are and the home kits are available. They're recommending to get tested if you have not already and follow the guidelines that we have just reviewed, right? So it's very important. If you have symptoms, you want to make sure you get tested. Yes, I have symptoms, but no, I tested negative. The recommendation from the CDC is that you isolate until you have been fever-free for at least 24 hours and your other symptoms are improving. No, I do not have symptoms, and no, I am untested, or I'm waiting for my test results, or no, I tested negative. So if you don't have symptoms, you have not tested, or you have tested negative, you do not need to isolate. But you should continue to reevaluate if any of the symptoms we talked about appear. Now, let's go down to this box over here. Right? Yes, I have symptoms, but no, I tested negative, or I don't have symptoms, or I tested negative, right? There's an exception, close contacts. Parents, I can't stress this enough. If someone in the home is symptomatic and has tested positive, we want to make sure our children are quarantining. It is important that our children are quarantining if someone in the home, whether it is mom, whether it's dad, whether it's a brother or sister, whether it's an aunt or uncle, grandmother or grandfather that live in that home, we want to make sure that if you were exposed, that you are quarantining. Right. And what is a close contact? As we talked about, people in the home, right? And when you are home, it's very difficult to be further than 6 feet, correct? So it's very important that you quarantine if someone in the home is positive. Now, let's go back to special exceptions for people in isolation. This really pertains to adults, and I'll share with you where it pertains to children. Right. So people who are unable to wear a mask have to then isolate for 10 full days. So we may have adults in the home that can't wear their mask, correct? Or perhaps our children who have certain medical conditions that struggle with wearing a mask. If they can't wear a mask, then they have to isolate for 10 full days. People who are in high risk settings, in a hospital as an example, right, isolate for 10 full days. If you have a severe medical condition and I would suggest, you always talk to your doctor, then you would have to isolate for 10 days. If a person was severely ill from COVID, correct, and they ended up having to go to the hospital, then it's 10 days. Those are the exceptions to the rule. It's only situations where if a person is unable to wear a mask because of their medical conditions, right? Medically fragile means that it is a 10-day quarantine, not a 5-day. So let's continue now, because I have another chart for our families. This chart is going to talk about quarantine. quarantine. And this is based on when the guidance first came out from the CDC on January 7th, which was before New Jersey Department of Health had adopted it. So again, we have the same symptoms, right? And that we reviewed earlier. Do you have any symptoms that are consistent with COVID-19, or have you tested positive for COVID-19? Now we're going to talk a little bit more about specifically the quarantine period. So let's start here. Yes, I have symptoms, or I have tested positive, right? You have to isolate. And we talked about previously what isolation is, right? Isolation is now 5 days. No, I have no symptoms. But then you have to ask yourself, are you a close contact of someone with COVID-19? Then if yes, I'm a close contact, you have to ask yourself, did you have and recover from COVID-19 in the past 90 days? Parents, this is very important because the CDC, as you could see, if you have had COVID in the past 90 days, you are not required to quarantine. However, you do need to wear that mask for 10 full days, very similar to the information we reviewed previously. So you had COVID in the past 90 days, in the past 3 months, you do not need to quarantine. However, you do need to wear that mask if you go to the supermarket, if you go to the pharmacy. And as you know, masks are required in our schools. So therefore, you don't have to quarantine, but you have to be able to wear your mask. Now, when you answered your question here, no, I have not had COVID in the last 90 days. So the question is, are you up to date with all of your COVID vaccine vaccinations based on your age and medical condition? So if you answer yes, I'm up to date with my vaccinations, you do not need to quarantine, right? You have to wear your mask. And then make sure you're reevaluating if your test is positive or if your symptoms appear. Now, if you are not vaccinated, right? No, I'm not up to date with my vaccines. Then you will need to quarantine for at least 5 days and get tested on day 5. Now let's continue. Did you get a PCR or antigen test, rapid test? For COVID-19, and do you know your result? If the answer is no, I did not get a test, or yes, I'm waiting for my test results, or yes, I received a negative result. The question then is, are you able to wear a mask for 5 more days when around others? Yes, then your quarantine can end 5 days after your exposure. Right? And this is for the unvaccinated. Unvaccinated is an automatic 5 days. And no, I'm not able to wear a mask, and you have to continue to quarantine for 10 days. Now, if you're not up to date with your vaccines and you have a positive result, then as we reviewed previously, you have to isolate. You have to isolate and follow the guidelines where you then have to test. Let's go through scenarios in our schools. So a student or staff member exhibits COVID-19 symptoms or has a temperature of 100.4 or above and has symptoms. So parents, it is so important that you do not send your child to school if they have symptoms, because the students will not be able to attend school. Students who have COVID-19 symptoms have to be tested for COVID on day 5. They have to quarantine for 5 days. And if those symptoms continue after day 5, then they have to continue their quarantine for an additional 5 days. If the symptoms improve by the end of day 5, the student can return. However, have to have those test results, correct? Students and staff need to wear their masks outdoors, like we talked about before, including during outdoor physical education classes or school sports on days 6 through 10 after completing a 5-day isolation. So parents, important, symptomatic, quarantine, If those symptoms continue after day 5, you see that your child is still very fatigued, still has some of those symptoms, and really is not up for going to school, it's important you keep your child home for an additional 5 days. And then what is the communication? Parents, you would need to provide those COVID test results to the principal and the school nurse. So the second scenario is close contact, right? A family member or someone in close contact with the student or staff member tests positive. The student or staff member stays home. The school administration will notify the student or the staff member, the teacher, to get tested around day 5. An unvaccinated student or staff has to quarantine even if they tested negative for a full 5 days after the last exposure. All the children in the home must quarantine for 5 days. And if they're unvaccinated, test on day 5. Because remember, if someone in the home is COVID positive, they are going to spread COVID very easily. Great, you're in the home, you're with your family all throughout the afternoon, morning, afternoon, and evening. Therefore, you have to be able to quarantine and test on day 5. In this case, if there's a case where it's reported that someone in the home is positive, one case, the classroom remains open. That is not a problem, but the responsibility is for the parent to notify the principal of who that family member is that has COVID. And in a classroom setting, our responsibility is to make sure we let the other parents know that there is a close contact of a COVID-19 case if it's in that classroom, correct? So let's say another student is COVID-19. We have to continue to communicate with our families that there is a positive case in that classroom. If it's a teacher, then we have to also communicate with our parents that there's a COVID-19 positive case in that classroom, right? And then you have to follow the recommendations with regard to knowing the exposure if you're vaccinated or unvaccinated, testing on day 5. And of course, we provide a letter to our parents and our teachers that are in that classroom. Next scenario, a student or staff member tests positive for COVID-19. The student or staff member is sent home if not already quarantined, right? So test positive. And parents, I want to thank you because I have to say our families have been incredible in notifying our principals and school nurse right away. So I have to say this is certainly not an area of concern because parents are already know if there's a positive case, stay home. If you're symptomatic, stay home. The administration needs to be notified. The public health department is notified by our nurses. An unvaccinated close contact identified and instructed to quarantine. And if there are 3 positive cases in the class, then the classroom will continue to close as we did previously. And again, with regard to communication, a letter is sent home to the students to the parents from that classroom, as well as that staff member. Let's continue with our scenarios. A vaccinated student or vaccinated staff member tests negative, right? If they test negative, they can return to the school because they're vaccinated. That's very important. Then they bring evidence of their negative COVID test or medical note. A vaccinated student or staff member has had COVID in the last 90 days, right? The student or staff member does not need to quarantine if exposed because they're vaccinated, right? They're protected. Students and staff need to bring evidence of the COVID-19 test, right? Or evidence of when they had COVID, so we can make sure our nurses can verify that, in fact, they did have COVID in the last 90 days. And then we talked about a student or staff member is medically fragile and experiencing symptoms. The recommendation is 10 days, 10-day quarantine testing on day 5. And again, we're asking our families to bring evidence of the test or that medical note with regard to the child's condition. Our nurses are certainly very well informed with regard to which children are medically fragile, but certainly having that conversation with the school nurse is very important. Now, parents, just want you to know virtual learning will continue to be an option if your child has to isolate or quarantine. Those are the guidelines from the New Jersey Department of Education. Those are the only reasons for which we can provide remote instruction, virtual instruction. So if your child has symptoms and you contact the principal right away, the principal will grant access so that your child can participate in their instruction virtually from home. So symptoms, quarantine for those 5 days or those 10 days, your child will continue to have access to their education. Let me provide an example here, though. If you travel and you reach out and say, I would like my child to have access to their remote instruction, the answer would be no. Travel, in accordance with the New Jersey Department of Education, you cannot be approved for virtual instruction. Only if you are having COVID symptoms, you are then in quarantine for the 5 days, or you're COVID positive. Otherwise, no other requests can be made for virtual instruction. Again, we've included, as we have in the past, the yes/no scenarios. So if your child is experiencing 2 or more of these symptoms, cannot go to school, stay home, right? Seek medical care. If your child has one of these symptoms, correct? Cough, shortness of breath, new loss of smell or taste, cannot go to school, have to stay home and seek medical care. If within the past 10 days you've had a close contact as having COVID-19, cannot go to school, stay home, seek medical care and testing, as we've discussed during our presentation today. If someone's been diagnosed with COVID, then again, you should not go to school unless you've been fully vaccinated. The unvaccinated must quarantine and get tested 5 days after exposure. Travel. So I talked about travel briefly before. If you've traveled internationally for our families that perhaps over Christmas break and then extended it when they learned that the district was going full virtual for the 2 weeks. So parents, if you have traveled, you do need to get tested 3 to 5 days after travel. Unvaccinated travelers get tested with a test also after travel. And if you or your child is unvaccinated, you have to quarantine for 5 days after travel. 5 days after travel. Just a reminder to our parents, and I certainly won't go through all of these, but we're practicing hand hygiene, ensuring that as we return to school, our children are washing their hands frequently using hand sanitizer. So we continue to reinforce how important this is. Physical distancing, 3 feet, that's still enforced in our schools. We, of course, keeping our physical distancing, ensuring that our furniture in the classroom is spread out. Also, that our children are facing in the same direction, and they can be in small groups as long as they are 3 feet apart. With our physical education classes, well, on a day like today, with the single digits that we are experiencing, we would not be outdoors. However, when it's appropriate, we do have our children outdoors. Today would definitely be an exception. And of course, we continue to be very observant with regard to contact and surfaces and ensuring that our children are wearing their masks at all times. And of course, as you know, Governor Murphy has extended the mask wearing requirement. So of course, parents, very important. All the adults and the students must wear their masks properly while they are in school. So we're reinforcing that. And then, of course, with regard to our school events, right now we continue to not permit field trips or other gatherings or assemblies. We want to make sure we're taking the proper precautions at all times. Of course, we continue with our physical barriers in our offices. We encourage our families to please contact the principal. We want to have a virtual meeting, phone conference, but certainly limit the interaction in our schools. And then, of course, we continue to encourage the proper protective equipment for our teachers and our assistants that are working with our children, our special needs children. As we continue maintenance and operations, We have our hand sanitizing stations. We have our personal protective equipment for all of our staff. Our nurses still have the touchless thermometers because they want to make sure if a child develops symptoms during the day that they're able to take the temperature and advise the parents. We're still sanitizing our buildings on a regular basis, so that continues. Our ventilation systems, of course, continue to be checked for proper operation. All of our classrooms have multiple air purifiers, as we have presented in the past, and that's to keep everyone safe. And of course, we carry all of these requirements on our school buses as well, right? The disinfection and the cleaning, as well as the face coverings on our masks, on our buses. And we talked extensively about COVID-19 testing and reporting. So after having gone through those charts, I certainly just have this as a reference. And again, parents, we ask for you to stay connected with our school district, visit our website. You can certainly download the app. And again, certainly check social media for any updates that the district is providing. I certainly will be in close communication with all of our families as we continue to navigate through COVID. However, we are certainly quite optimistic with the information that the CDC has shared, and also the fact that our cases have significantly been reduced in the city of Elizabeth, which is why we made the announcement that we were able to reopen our schools on Tuesday, January 18th. I'm going to ask now our school business administrator, Mr. Kennedy, our assistant superintendents, Dr. Cedeno, Mr. Cortez, and Mrs. Finch Johnson, all assistant superintendents, if they could please turn to the chat. And if there's any questions, we certainly will be happy to address.
So at this time, there are no questions in the chat, but please, if there are.
Wonderful. And again, parents, we will be providing this presentation to our families. It'll be translated in Spanish, and we will also have it translated in other multiple languages to ensure that all of our families understand what the new protocols are, what is required. And, this is an adjustment. So we have to adjust now to new guidelines and ensuring that we keep everyone safe. Thank you, everyone, for your time today. As Dr. Cedeno said, please, if you have a question, click on the chat and you can type your question. Mr. Lopez, please share your question with us.
So I've had concerns with your IT. I know that this is not, I appreciate you taking this time in the morning and giving this pretty comprehensive explanation on that. But I mean, let's be honest among us. I mean, here, I mean, IT is moving. The internet has become a utility. It's like electricity. It's like water. I mean, are there any discussions among your leadership team and yourself and about making it into a utility in the city? I mean, there's various cities throughout the country that have basically made the internet a utility, and they provide equity to everyone in their cities that way. I mean, I'm thinking of Arlington, Virginia, or Alexandria, or different cities along those lines. You go there, the internet is available to every citizen, and there's equity. I mean, I've seen instances, it's gotten better, where I see parents driving up to schools and they park their cars next to the school to try to use the internet, the Wi-Fi for that particular school. I mean, are there any thoughts of that? I mean, moving forward, and I also, I'm kind of surprised. I mean, obviously you're handcuffed by how the teachers union regulates teachers' times and all that kind of stuff. But a lot of the teachers are still teaching like they're teaching physically in the classroom, and the online instruction has become a completely different thing. I mean, if it's utilized properly and done properly, it can be as effective, or even in many cases more effective. I mean, you have the ability to be anywhere literally on the planet, and you could have a teacher teach students about, like the Amazon jungle or something like that, which obviously we're not going to take every child in our school district and take them there and show them, the significance of, a jungle or something like that, or do science lessons and stuff like that. I mean, are there thoughts? I mean, number one, IT, I have a very big concern. I mean, in particular case of my daughter, her battery died on her computer, and then we had to spend an hour and a half waiting in line outside. And we called IT multiple times, left multiple messages. We were told they would get back to us. They never got back to us. And I said, well, maybe they just don't care about the parents. But my daughter, when her teachers would call, it would be the same thing. They would never get an answer. And even now, which I think it's gotten a little bit better supposedly, but the teachers call, they leave it on running in the background while they're teaching their classes, waiting for the IT people to get back to them. I mean, it seems maybe there's a deficiency of personnel there, or is there thoughts there? For my second question was, is there a discussion maybe among the government in the city government about exploring with a lot of the internet companies making the internet a utility in Elizabeth and providing equity so everybody has the same bandwidth and same speeds to work with, so that every child can have equity? I still see a lot of the children, depending on the service they have, where it freezes up on them and stuff like that, and they drop out, and all of those things kind of happen. So I know I asked a lot of questions there, but I think they're all related to what we want the best for our children.
Agreed, Mr. Lopez. Thank you so much for your questions. I'm going to address each one with regard to the internet access. We certainly, from the very beginning, from the pandemic, that was one of the priorities of our IT department, to ensure that families that did not have internet access were provided hotspots. I understand your question with regard to a citywide initiative, and I think that is certainly a very valid point with regard to where we are as a society and where we need to be moving forward. I can certainly speak with regard to our school district and prioritizing hotspots for our families. We've been surveying our families, following up with families. We had a very aggressive initiative through our IT department of contacting families and ensuring that they had the access, and if not, providing them those hotspots so that the children could access their education. With regard to the concern that you presented regarding your particular experience with the laptop, that's something that we've been working with our principals with regard to ensuring the process involves the teacher, once informed that the child has a difficulty with his or her laptop, they're required to put a ticket in. Our IT department's response time at this present time is all concerns that are reported on that day are responded to on that same day. That has been a significant improvement when looking at our data from the beginning of the school year in terms of the delay in submitting the concern or responding to the concern. So right now we are responding on that same day and communicating with the families with regard to the process. If there's a difficulty with the laptop, what our IT department has been doing is essentially replacing that laptop with a brand new one, as opposed to taking that laptop, identifying what the issue is, fixing it. The protocol we have in place is an immediate replacement with a brand new laptop. And that ensures that we are addressing that issue right away so that the impact is only within that same school day, as opposed to waiting 24 or 48 hours, correct? In terms of, I think I covered the IT question as well as the issue with your laptop personally, and in terms of the process for responding. I hope I addressed. I addressed your questions. Certainly, the functioning of our IT department has been a central focus of my leadership, as well as our cabinet, our assistant superintendents, our school business administrator. We review on a daily basis the data with our Chief of IT, Mr. Alberto Marsal, to ensure that we are responding to our families. But your point is very well taken with regard to, as a society, ensuring that this is something that is available to families district-wide or school city-wide.
I do have one question, Madam Superintendent, a clarification regarding the quarantine for international travel versus in-state, out-of-state travel? If you can just clarify that.
Absolutely, absolutely. The requirement for travel in accordance with the CDC, it is international travel. Unvaccinated adults and students are required to quarantine for 5 days. Now, travel between the states does not require quarantine. It is only for international travel. If you are unvaccinated, you are required to quarantine for 5 days. I would like to share, that is a wonderful question. And in the discussions that we have had, and in terms of how we can support our families, if they have returned to the United States and now they're unvaccinated, have to quarantine during those 5 days, we are supporting instruction because the child is home, is under a health department imposed quarantine, and therefore we do support the student with access to their education. If the student is in quarantine in their native country as a result of being COVID positive, we cannot grant that international access any longer. We can only support our students to access their education if they are quarantined already in their home. So thank you for that question. That was phenomenal.
Yes. And at this time, there are no other questions in the chat.
Wonderful, wonderful. This session has been recorded. However, as I stated previously, my intent is to offer the same session in Spanish to our families. We will also have additional translations available in the multiple languages. And I will also offer additional sessions throughout the course of next week. I know that not everyone was available to participate today, so my intent is certainly to provide this opportunity this upcoming school week as we transition back to our schools. Thank you, everyone. Thank you for your time. Thank you for your questions, and certainly wish everyone well.